It's the deadliest mental illness in the United States, killing one person every 52 minutes. We're talking about eating disorders. They're difficult to treat, with few therapists trained and long waiting lists for those who are.
A first-of-its-kind program in Spokane is taking a new approach to helping patients battling the disorders. 4 News Now's Robin Nance met with the woman pioneering this novel treatment.
I like to have a lot of fun. I'm pretty just like outgoing, love to chit-chat with people.
22-year-old Megan Erickson has lived in Spokane her whole life. She went to school here, performed in theater here, and attended Whitworth.
I always love to go on new adventures.
Megan's adventures took her down a path she did not expect.
I'm bulimic.
Her eating disorder started early in the pandemic. It began by restricting what and how much she ate.
So it became a really big thing of I'm going to control this little aspect of my life when I didn't feel like I had much control.
She started over-exercising, then making herself vomit. What started with that feeling of control took over and went on for several years.
And I realized, I was like, most people don't vomit after every single meal, after eating any food.
So you would do it that often?
Yeah, every single time I would eat, I would vomit, which was so tolling. And I lost so many friends. I felt I couldn't be social. It was terrible.
Megan, a typically very open young lady, began withdrawing from family and friends.
And now looking back on it kind of with hindsight, you're thinking, oh man, she was just trying to kind of keep this thing going as best she could. And then that took all of her bandwidth.
She finally opened up to her parents and found the courage to ask for help. And they found that help right here in Spokane with therapist Krista Crotty, who understands how difficult it is to treat someone with an eating disorder.
This is the only mental health condition, when we think about all of the ones that are there, that typically speaking, specifically when we talk about the data with anorexia, people feel better the sicker they are.
Krista has a PhD, a private practice, and has now launched what's considered a novel treatment in Spokane called TBTS. It stands for Temperament-Based Treatment with Supports. The program runs in Norway and Australia, and Krista's is only one of 2 operating in the United States.
We look at the trait, so we're going to understand and look at the root of the eating disorder and treat to the trait versus treat to the symptom.
Typical eating disorder treatment focuses on behavior modification with the patient alone and may sprinkle in limited therapy involving the patient's family or support system. One of my children battled eating disorders for years. In fact, this is a picture of her in the hospital and when I dropped her off at an eating disorder treatment facility. It was hell for her. And for me as her mom, I felt completely helpless and hopeless on the outside with very little guidance on how to help my child. TBTS is different. It is an intensive 5-day program for a total of 40 hours with not just the patient, but up to 6 members of their support network.
So we bring the support in, we teach them all the skills side by side with the client.
For Megan, that included mom, dad, and her brother. It's a sacrifice for the whole family, but worth it.
It's really hard to fight a battle that's so ingrained in my life without other people around me.
I would have just been doing my old same thing. And I wouldn't have been able to really give her the help that she needed and the way that she needed that.
We learned so much about my eating disorder. We practiced different skills of what my brain might tell me in stressful situations. We sat and we ate meals together. We did mindfulness stuff. And so just that week was the first week in over 4 years that I didn't purge after my meals.
Even after going through TBTS, Megan went to a residential treatment center. Krista says her program is meant to be an augmentation to programs already in existence.
We're seeing better outcomes, long-term recovery, improvement in just personhood, because a person's no longer being asked to stop being who they are, but we're going to use who they are to help them get well.
Megan is on that recovery journey and can now think clearly about her future.
I see the hope of I'm going to be able to be a teacher, I'll be able to be a mom, and be there for my friends and other people that I care about in my life. So
in Spokane, Robin Nance, 4 News Now.
You can learn more about eating disorders and TBTS by finding this story on KXLY.com.